All right. So 2:31. So let's start. Good afternoon, and thank you for joining PSHSA's the Workplace Reimagined Virtual Conference. My name is Christine Jedica, and I'm a health and safety consultant with the Public Services Health and Safety Association. I am pleased to welcome you to Domestic Violence: How Workplaces Can Help to Address the Shadow Pandemic, presented by Barb MacQuarrie, the Community Director at the Center for Research and Education on Violence Against Women and Children in the Faculty of Education at Western University. Before we begin, I want to mention that there will be an opportunity to answer a few questions following the presentation. Please feel free to enter your questions in the chat and we will select some to answer from there at the end. As the number of cases of COVID-19 surge, so do the domestic violence rates. Making sense of what this means to workers and to the workplace is urgently needed. Barb MacQuarrie, Community Director of the Center for Research and Education and Violence Against Women and Children at Western University in London, Ontario, has led research and education initiatives to address gendered violence and harassment in the workplace since the 90s. She has been widely published and has spoken worldwide about issues related to gender-based violence. In 2014, she coordinated the first Canadian national study on the impact of domestic violence on the workplace, and she has coordinated similar studies in Asia and Europe. She convened the International Domestic Violence at Work Network between 2014 and 2017, which contributed to new policy and legislation initiatives to address domestic violence in the workplace in Canada and around the world. Barb is the recipient of the Order of Ontario, the province's highest official honor recognizing individual excellence. We are pleased to welcome Barb, who will discuss domestic violence in the wake of the pandemic and tips and strategies for workplaces to put in place for those who may need support. Hello and welcome, Barb.
Thank you. Thank you very much for having me. So I am going to talk today really about the intersections of COVID-19, domestic violence, and the workplace. In terms of what we're going to talk about, as mentioned, I'm going to talk about the increased reports of domestic violence during the pandemic. I'm going to talk about why public health measures that are intended to protect us from the virus have created added vulnerability for those who are experiencing domestic violence. I'll talk about the potential impacts of domestic violence on those who are working from home. I'll talk about what we know to date about legal responsibilities for employers to protect workers. And then I'll look at some strategies for employers to support workers who may be experiencing domestic violence. So really, I thought we should start with just defining our terms. So when I say domestic violence, I mean any form of physical, sexual, emotional, or psychological abuse that includes financial control, stalking, and harassment. I'm talking about behaviors that happen between opposite sex or same-sex intimate partners who may or may not be married, living common law, or living together. They may also, of course, be living apart. These behaviors can continue to happen after a relationship is ended. And in fact, often that's when we'll see an escalation in the behaviors, is when the relationship ends. It's really important for us to remember that we're not always talking about physical violence or just physical behaviors. So this concept of coercive control is really important. And what do I mean by coercive control? It's an act or a pattern of acts of assault, threats, humiliation, and intimidation, or other forms of abuse that are used to harm, to punish, and or to frighten a victim survivor. I'm going to use that term sometimes. Instead of saying just victim, I'll say victim survivor. It helps to keep the victim survivor dependent by isolating them from support, by exploiting them, and by regulating their everyday behavior. So that's what I mean when I say domestic violence. Let's just briefly review who experiences domestic violence. So certainly This form of abuse can affect anyone of any gender, but it doesn't affect all genders equally. We have the StatsCan General Social Survey, which shows us that men and women experience and perpetrate domestic violence in roughly equal numbers. But if we go a little bit deeper, we see that as the severity increases, women are much more likely to be victims. And so women are more likely to experience serious injury, to fear for their lives, and to be sexually assaulted. We see that reflected in police stats. So in terms of victims who report to police, almost 80% are women. And then where we really see where the gender difference in this abuse is in domestic homicides. So the most severe form of the behavior. The Ontario Domestic Violence Death Review Committee has been collecting data since 2002. We're starting to have similar death review committees across the country, but Ontario's is the longest standing and is the most well established. And so what they tell us is that in terms of people who's killed as a result of domestic violence, 81% of victims are adult females, 9% are children, 10% are adult males. Now, some of those adult males who are killed are as a result of murder-suicide. So when you look at the perpetration side of things and you break that down by gender, what you find is that 97% of perpetrators, those who kill their intimate partner, are men. 3% are women. So why is it such a gendered problem? I think there are many reasons, but one of the most important ones is that we have social norms that really endorse male control. This is reflected in the wage gap, where on average women earn less than men. I think we're between 75 and 80% to the dollar at this point. It's reflected in political and corporate leadership, where women are underrepresented, and in widely accepted expectations that men are going to control what happens in the home. As the concept of gender expands and become more fluid, we're also seeing higher rates of domestic violence for trans and for gender non-conforming people. And just as an example of this, in the 2014 survey that was mentioned, 38%, these are lifetime prevalence rates, 38% of women had experienced domestic violence, 17% of men, 65% of trans and gender non-conforming people. So we see that this latter is really a very vulnerable group. So why do we want to understand the gendered nature of domestic violence? The answer is really simple. It helps us to identify those who are most at risk. This is not in any way to deny that domestic violence happens in same-gendered relationships, or that men also experience domestic violence, or that women could be perpetrators of the behavior. But understanding the gendered nature does help us to understand that the root of the problem lies in gender inequality. Let's turn our attention now to how COVID-19 and the pandemic has impacted the experiences of domestic violence. So we have stay-at-home orders, which are intended to protect the public, prevent widespread infection, but which has also left many victims survivors of domestic violence trapped with their abusers. So social isolation creates more opportunities for perpetrators to impose control and to monitor victim survivors. We now have fewer opportunities for outsiders to see what is happening. We have more daily exposure to violent partners. We have fewer opportunities to escape permanently or even temporarily. And I want us to remember that the workplace is very important for providing temporary safety for survivors of domestic violence. At the same time, we have an increase in risk factors that lead both to intimate partner abuse and child abuse. So these are things like financial stress and economic insecurity, more alcohol and substance abuse, and family tensions related to childcare. Early in the pandemic, April 2020, Statistics Canada released a survey that captured some of this reality, where 1 in 10 women reported being very or extremely concerned about the possibility of violence in their home due to the stress of confinement. So experts attributed these numbers to the pressure cooker environment created by increased economic insecurity, social isolation, and an inability to leave abusive relationships due to lockdowns. The pandemic also presents a situation in which which is harder to report. We have conditions that suppress and delay survivors' access to report and to support as well. Black and brown people who have long faced oppression and brutality by police may also be less likely than white people to involve police if domestic violence escalates. In the early days of the pandemic, domestic violence hotlines were preparing for an increase in demand as lockdown measures were imposed, but many organizations experienced the opposite. In some regions, the number of calls dropped by more than 50%. Experts knew that the rates of domestic violence had not decreased, but rather that victims were not able to safely connect with services. Advocates recognized that the greatest demand for services, for shelters and other supports might not emerge until after reopening had started and survivors faced fewer barriers to access these services. So some even described this demand for services as a curve coming after the COVID-19 curve. In order to meet the unique demands of this curve in demand for services that follows the COVID-19 curve, it's really important that shelters and family services continue to receive the resources that they need to support survivors of domestic violence. We have seen some additional support coming from our government at this time. Again, earlier on in the pandemic, we had a Statistics Canada analysis that used data from 17 police departments across the country. This was the first 4 months, so March, April, May, June. It showed a 4.3% drop in reports of domestic violence to police compared with the previous year. However, at the same time, it showed that police-related calls for domestic disturbances increased by nearly 12%. And when you look at what a domestic disturbance can involve, it can be anything from a verbal quarrel to reports of violence. For many of us, it wasn't no surprise that reports to some police agencies were staying the same or dipping during the early days of the pandemic because of those limited opportunities for victim survivors to seek help. But despite some initial drops in reporting, evidence soon began to emerge, and it became clear that the COVID-19 pandemic has escalated domestic violence worldwide. It's UN Women who coined the phrase the shadow pandemic, referring to this escalation. So the United Nations Family Planning Association captured data that showed a worldwide increase in gender-based violence. In the first 3 months of the pandemic, we saw a 20% increase in numbers of reported cases of gender-based violence. That translates to 31 million additional cases in the first 6 months of the pandemic, and an additional 14 million cases every 3 months thereafter. Because sexual violence outside of the home actually decreased with lockdowns, these numbers can be attributed largely and primarily to domestic violence. And the increased reporting to helplines came too. As COVID-19 cases surged across Canada, so did reporting rates. Reports increased by 20 to 30%, and crisis calls by as much as 400% in some Canadian regions. So just to give you an example, in Toronto, the Assaulted Women's Helpline usually receives about 4,000 calls per month. This year, counselors picked up more than 55,000 calls between March and September alone, representing an additional 27,000 calls in 7 months. A similar pattern emerged across the country. So calls to a Vancouver-based crisis line for women experiencing domestic violence jumped by 300% over a 3-week period in April. And in Saskatoon, despite a surprising drop from when the pandemic first hit, local police reported a 10% increase in domestic violence reports in May. So you can see that as things began to open up more, we got more survivors able to make those contacts, whether to police or to other kinds of supports. Violence Against Women agencies conducted the first national survey of those who work with sexual assault and domestic violence survivors during the pandemic. And what they found is almost half of the workers surveyed said that they noticed changes in both the prevalence and the severity of the violence. The violence was increasing and getting more frequently. About a fifth said that abusers' violent tactics changed and control increased, including a sharp increase in cases of strangulation. Really, really high risk, serious abusive behavior. So more cases of strangulation and physical assaults, of course, lead to a higher risk for lethality. And what about the children? Closures of schools and childcare facilities have added to the stress at home. The added stress of balancing work, childcare, and children's education has led to an increase in child abuse. Children were in lockdown for 6 months without access to trusted adults outside of their home. Mandated reporters such as teachers, childcare reporters, and clinicians had fewer opportunities and fewer interactions with children and families, and fewer opportunities to assess, to recognize, and report signs of abuse than before the pandemic. The World Health Organization calls violence against children the hidden crisis of the COVID-19 pandemic. In Canada, Kids Help Phone has reported an increase in specific conversations about physical, sexual, and emotional abuse. So with kids back in school, we expect to see increased reports of child abuse. So while people of all races, cultures, genders, sexual orientations, socioeconomic classes, and religions experience domestic violence, this kind of violence does have a disproportionate effect on communities of color and other marginalized groups. Economic instability, unsafe housing, neighborhood violence, the lack of safe and stable childcare, and the lack of social support can worsen already tenuous situations. We can't address domestic violence without also addressing social factors, especially in the context of a pandemic that is causing substantial isolation. Now let's begin to examine the impacts all of this might have on survivors of domestic violence who are working from home. Well, to begin with, employees' work is more easily disrupted during confinement. It's easier for an abuser to control all aspects of the survivor's movement, including their work by destroying work resources or by controlling access to a telephone or computer needed for online meetings. Tactics of control include frequent interruptions of work, refusal to carry out childcare, surveillance, physical violence, and preventing someone from completing work tasks. Of course, access to supports is more restricted. I've talked about that. It's harder to make a call to a friend or a work colleague, to contact a helpline, to talk to a manager about accessing workplace resources and supports. Health and safety might be affected by denying someone access to soap or to hand sanitizers. Somebody may be prevented from going out shopping, even to the supermarket or the pharmacy, where it might be possible to alert somebody with the need for help. Working from home, it's also harder for managers to recognize signs of domestic violence. So a lot of us are stressed. A lot of us, for many reasons, may not be responding to calls. Might be related to childcare or other problems that are happening during the lockdown. So we all in all, we are just dealing with a situation that's more complex. It's harder to know for sure what's going on. UN Women, again, have made a pretty strong statement. They've said that the unprecedented increase in domestic violence since the onset of COVID-19 pandemic marks an urgent call for action for the private sector to leverage, and the public sector as well, I would add, to leverage existing resources and influence to keep women safe at home and safe at work. Employers have a duty of care to their employees working remotely from home and are in a good position to support those who may be affected by domestic violence. So I just want to spend a minute talking about the importance of economic independence. For many people who experience domestic violence, the financial entanglement with an abusive partner is too convoluted to sever without an alternative source of economic support. The pandemic has exacerbated financial entanglement by causing increased job loss and unemployment, particularly among women of color, immigrants, and workers without a college education. So in March, women aged 25 to 54 lost more than twice the jobs that men in the same age group lost, according to Stats Canada. As of June, the number of women returning to work was being outpaced by the number of men returning to work. So again, to quote UN Women, they've said keeping women safely in their employment, including when working remotely, with the possibility of financial independence, is critical to enabling women to survive domestic violence. So workplaces have a role. Starting for many companies has been to draw up workplace policies with support and with safety measures. Many companies are using existing channels to promote employee awareness of domestic violence. These might be health and safety programs, internet websites, or other internal programs and communication activities, harassment and violence awareness campaigns. It's a really important opportunity to leverage the momentum of existing mental health and workplace wellness initiatives. Although these are distinct issues, but they're fighting stigma and making it okay to talk about problems like mental health and like domestic violence at work. So if we can work, if we can work towards eliminating the stigma associated with domestic violence by talking about it in the workplace, employees will feel more comfortable coming forward. This will help us to understand that domestic violence is a social problem, not a private problem. And employees can feel more assured that they won't be viewed as less than professional or otherwise deficient because they disclose domestic violence. In these communications, we have to be sure to clarify that confidentiality will be respected to the extent possible, and that information will be shared only as needed to protect safety in the workplace. We want to communicate regularly with employees in order to reduce that isolation that they're experiencing. We want to provide employees with guidance on what they can expect if they disclose domestic violence. We want to reassure them that they're not going to receive, that they will receive employer support, and that their jobs will be protected. Some options in this regard include non-traditional means of communication, such as hand signals. That's been promoted by the Canadian Women's Foundation, and code words that can be used on voice or video calls that employees can use to silently indicate a need for help while they're at home. Really, it would be a good idea to have these kinds of measures in place before the pandemic. If you don't, then you're kind of trying to do something in the middle of a crisis. And I don't want to discourage you from doing that. When setting up ways to communicate danger with your employees is a really important thing to do. I would just encourage you not to drop that after the pandemic is over. And remember that these are measures that can be helpful on an ongoing basis. We also don't want to forget that there's still a critical role for emergency response services like police. And should a situation arise where we believe there's a threat of imminent danger, we want to be able to rely on police. We want to share information about internal and external resources. One of these really important resources is paid leave. So this is now being, whether you are provincially regulated or whether you are federally regulated in Ontario, workers have access to 5 days of paid leave. Many workplaces will have additional access either through workplace policies and or through collective bargaining. We want to provide external information and resources to make employers aware of ongoing services and resources available in the community. This will include things like shelters, transition houses, crisis lines, legal clinics. We could adapt workplace security measures for the at-home context wherever possible. So for example, an employer can establish a preset emergency telephone number or a panic alarm that's connected through mobile phones. You can ensure that a company established website is inaccessible by third parties. For some employers, these measures may not be feasible. So you really want to look at the structure, the resources, the communication channels and methods of your own workplace, and think about how they can be adapted to promote greater security and to provide avenues for communication with survivors. Now, we also want to be watching for warning signs that somebody may be experiencing domestic violence. And I'm just going to say that I understand this is difficult. Warning signs do not mean that it's a case of domestic violence. There could be other reasons for all of these. But maybe it's a time to start asking questions and to just asking somebody if they need help, they need support, they need resources. If you see somebody who's distant, withdrawn, not fully participating in calls or online meetings, you have somebody who's tired or worried, distracted and anxious, somebody who's often called away or interrupted by a partner when they're on the phone or in an online meeting. You might also want to watch if Children are coming in during video calls, and they appear to be stressed, anxious, afraid. And of course, if we do receive a disclosure of domestic violence, we want to be responsive and we want to be supportive. So we want to be the key to this is not to be judgmental. Also remember that as a supervisor, a manager, an employer, you can work with police and or domestic violence services. You don't have to handle these situations on your own. So they can be very helpful to do things like carry out a risk assessment, develop a safety plan. Part of the safety plan, you can go back to looking at, would paid leave be helpful? Does somebody need some time, or is it actually more helpful for somebody to stay connected to the workplace at this time? So I want to say a few words about legislative responsibilities, and I want to acknowledge that these legislative responsibilities are evolving, and some of them quite quickly. But employer violence and harassment policies do extend to cover employees working from home. The policy and program should include instructions how employees can confidentially report domestic violence, how employers will respond to incidents, and the resources that can be assessed, and how a workplace safety plan can be developed. So I've given quite a few suggestions about what workplaces can do to try and support employees who might be experiencing domestic violence. Aside from the paid leave, they're not specifically, those specific actions are not specifically required by law in Canadian jurisdictions. The law in this area remains nebulous and unexplored in many respects. What we do know is that occupational health and safety legislation is recognizing domestic violence as a workplace hazard. Certainly that's true in Ontario, and it's now, as of January 1st, true federally. So employers have pretty explicit duties to prevent and protect workers. As teleworking becomes more common, we can expect more clarity on employer expectations when employers are working from home. But good employers aren't going to wait for those legal decisions. They're going to connect with employees on these issues while they remain compliant with their jurisdiction-specific privacy and human rights laws. How this translates on the ground practically may be an issue for courts and legislators to tackle, but meanwhile, employers would be wise not to lose sight of this important subject, above all during these uncertain times that have been caused by the COVID-19. And I wanted to finish by saying that as we think about recovery from the pandemic, we now have news of 2 vaccines which are potentially effective. So I think we are starting to think recovery. I'd like us to think about recovery from a gendered lens. So that includes gender-based violence prevention, but it also includes things like childcare, universal basic income, because poverty is very deeply gendered in Canada. So a priority lens on women and intersectionality, so looking at other marginalized groups and how they've been disproportionately impacted, is really going to be key, I think, to a strong recovery here in Ontario and in Canada. So thank you. We'll
Thank
go
you
into
so
the Q&A session.
Thank you so much, Barb, for such a great presentation. Very enlightening with the information. I don't have a lot of I'm going to see if I can. If anyone wants to unmute their line to ask a question, feel free. We've got a few minutes for that. I did have a question. I know you went over some of the things that supervisors can do, but I know that in the workplaces, particularly in those workplaces that may not have already put in some sort of management system where they've kind of put it into a process that allows, everyone to kind of understand what they need to do, or at least have a process that they can follow to better manage this. What would be maybe a couple of tips? I know you did in your presentation for supervisors, sitting in the room and saying, where do I start right now?
I think a really good place to start is just by making it known that it's okay to talk about this at work. I think that you can have the best policy in place, you can have a brilliant procedure in place, but if people don't trust that it's okay to disclose, or maybe to talk about being concerned about what's happening to a coworker, you're never going to know about it. And so initiatives that it could be simple things, it could be lunch and learns, bring in a local shelter worker to talk to you. It could be posting information on your intranet. It could be, if you have means for organization-wide communication, including things in there, not just making it always just about domestic violence, but always whenever you're talking about impacts of COVID on the workplace, on work, on the organization, remember to say something about domestic violence too. So I think that, building up that communication, that culture of open communication, and having a sense that it's okay, you can trust, we're here, we'll listen, and we'll support. It's the absolute most important step.
And I love the fact that you said, once they understand that they can work with other agencies such as police or outside agencies to get the resources that they need. So they don't need to have the answers. They just need to listen and start the conversation.
Absolutely. And so I think one of the biggest obstacles for many employers, supervisors, managers is thinking, well, I'm not a domestic violence expert. I have this is very far outside of my range of expertise. You don't need to be an expert, and we're really not asking you to be experts. There are community-based services all across the province. Almost every community has a women's shelter that to serve their area, and some have several. In addition to that, we have counseling agencies, we have specialized organizations that provide all kinds of services for survivors. They would be happy if you reached out to them to work with you. This is a way, I think, for us to be in touch with survivors who maybe otherwise wouldn't come forward for support. It's so, yeah, you can just be a really important link as an employer, as a supervisor.
Well, thank you so much, Barb, for sharing your work